assessment of gastrointestinal function outline. So for the next few chapters, we'll talk more about the disorders, diseases, but now in this chapter, we have the assessment. And we have introduction, anatomy and physiology. Every time when we go into a system, they have the assessment, and it's a small review about anatomy and physiology. Then the real nursing assessment and diagnosis study that the nurse need to know about lab studies, imaging studies, ultrasonography, and barium studies. And here it's subdivision and endoscopy, age-related changes. Every assessment chapter has age-related changes. And because of the smooth muscle tone decrease, heartburn, cancer rates. So this is my concept map for